Welcome to the Texas A&M University College of Veterinary Medicine and Biomedical Sciences Peer Program's continuing video conference series. Today we'll be talking about the science of smiles. Dr. Bert Dodd from the Texas A&M Small Animal Teaching Hospital will be talking to you about the anatomy, physiology, biology behind teeth and dental health for your pets. In learning about the way to take care of your pet's teeth, you might learn something about how to take care of your own as well. We hope you enjoy our program.
Howdy. Thanks so much for joining us today on this presentation. I hope that we can have some fun during the process. We're going to talk about being a veterinary specialist and what's required as far as getting to that point. The AVMA has several different specialties, and you need extra training beyond high school. So please listen in as we try to share with some of that information. All these specialty areas are evaluated on your knowledge and skills in a specialty area, and there's no way that any one person can know enough about the complete field of veterinary medicine. So we do have a lot of specialties that are involved, and those in specialties include 22 different organizations under the AVMA, and that includes 41 distinct different specialties, whether it be in dentistry or zoo medicine or internal medicine, rehabilitation, orthopedics, just lots of different specialties. What's required beyond high school are 11 to 12 additional years of school, and that's 4 years of an undergraduate program, another 4 years of veterinary school, and then 1 year of an internship, and then another 2 to 3 years of a residency program. And so it's a lot more schooling that's required. Along the path, there's going to be research that needs to be done, as long as publications that have to be provided as well. At the end of all that time, you get to take another little test that you have to pass, and so that you can become board certified in your specific area. Why do you need specialists? Well, pets require specialized care and knowledge and special equipment, and there's no way, again, that one person can do all of that. So we need to specialize out so we can provide our pets with the best possible care. Now, that doesn't mean just small animals, but large animals and zoo and aquatic animals as well. What is veterinary dentistry? My particular area is veterinary dentistry, and that includes the diagnosis and treatment of different oral diseases. It may be something as simple as gingivitis, which can progress to periodontal disease, and then malocclusions, or bad occlusion of the different teeth, fractured teeth, oral tumors, fractured jaws. All these kind of things are involved in veterinary dentistry. And let's take a look at the teeth themselves and their functions of the different species. Teeth are used to hunt, they're used to attack, they're used to prehend their food, they're used for defense, and to break down the food. Once they pick up the food with their teeth, then they have to break it down so they can swallow it. And then the teeth are adapted to diet depending on the type of species that we're dealing with. And there are many different species. So the types of teeth involved are the different types are shaded here in different colors. The molars are the large flat teeth in the back of the mouth that are used to grind. And on this picture, they are the blue color. The premolars, or the pink ones, are located between the molars and the canines, and they're considered transitional teeth used for crushing food. In front of those are the canines. They're long pointed teeth at the corners of the mouth that are used for grasping and for tearing. And then the front of the mouth, the ones that you see most commonly, are the incisors. And they're thin blade-like teeth that used for biting and for cutting. Herbivores is one species of animals, like horses and cows and goats, that have teeth that are needed for grinding their food. Their primary food source is plants. So all the grasses that they eat and the seeds, and that's the way that they use their feed. their food. So the teeth that they need are going to be more of the grinding food teeth, like the premolars and molars. And they're primary consumers of plant food. The teeth are adapted for rasping and for grinding. So you can see that cow picture's got food hanging out of her mouth. She's grinding that food. Now this is a herbivore food mouth. This is a cow's teeth. And you can see on the bottom jaw that they have incisors. They don't have premolars. And then they have, they don't have canine teeth. And there's no incisors on the top jaw. So we have primarily molars because their diet is designed to grass. It has to be ground up and swallowed. And then they're often missing their canine teeth. Their large incisors, or horses have upper and lower teeth, and then the cows and goats only have the lower incisors. So as we look at this little calf, you can see the lower incisors, and on top they have what's called a dental pad that they chew against. And it's just a way for them to grab a hold of their grass, break it, and then with their tongue move it back into their mouth so that they can grind it with their molars. This shows the grinding action of the teeth of a horse. And I'm probably going to have to move over so I can collect that loop. So if you'll hit that loop button, we'll show how the teeth will grind. And you see the little red mark shows you where the teeth are in contact. So right now the molars are in contact, and now the incisors are in contact, and as it rotates now the right side is in contact. And they continue to move around like this as they grind their teeth against the food, and causing it to crush and be allowed to be swallowed. Carnivores is the next type of animal that we'll look at, and that's your dogs and your cats. They primarily eat other animals and meat byproducts. So in order to do that, they're going to have specialized long, sharp teeth adapted for ripping and for tearing. So the carnivores have, again, the full set of dentition. They have molars, premolars, and canine teeth. So the canine teeth are well adapted. They don't have as many molars because they don't grind their food like horses and cows do. They have to tear it up and grind it just small enough so they can eat it. Sharp incisors are needed. And then as we get into our omnivores, and that's animals that eat plants and animals. So humans, monkeys are all omnivores because we eat all types of food. So the energy that's obtained from both meat and from plants, and so with that we have different types of food adapted for the various species. So we look at the omnivore teeth, and so we have all types of teeth that are developed specifically for the type of diet they have. And I'll show you this example of an omnivore, or this is actually a monkey, a gorilla. You can see his teeth, and there we go. You can see that they have canines and premolars and molars. All of these are very different from what you see in a dog or a cat. All right. So now let's look at the tooth itself and what it's composed of. You can see on the right side of the screen that you have the crown, and that's the part of the tooth that's above the gum line. Below the gum line is the root. And within the different structures of that, the crown, you have the outermost layer is called the enamel. The enamel is the hardest structure in the body, and it's what protects the tooth. It's very solid where nothing can penetrate through the enamel to get into the tooth. The dentin is the live layer of the tooth right underneath the enamel in the coronal part of the tooth. But as we move down the crown to the root, the dentin also lines the entire root. On the outside of the dentin in the root section is the cementum. And the cementum is a very porous area that allows for exchange of nutrients in and out of the tooth they migrate through the dentin. Now the tooth is cemented into the alveolar socket or the bone through little structures called the periodontal membrane or the periodontal ligaments. And those are fibers that attach to the cementum and then attach to the bone to keep the tooth in the mouth. The middle part of the tooth is called the pulp cavity, and within the pulp cavity are many nerves and blood vessels, arteries and veins that exchange nutrients that keep the tooth alive. If the enamel is broken through a broken tooth and exposes the dentin or even exposes the pulp, then the tooth will normally die and need to be extracted because it becomes abscessed. If you can get to a dead tooth early enough, you can save it by a root canal to remove the dead part of the tooth and then put a cement on the inside to protect it so you can maintain it for its function. Now let's look at dental health itself in our pets. To maintain properly dental health, preventive is the most important thing that we can do. Preventing dental problems is just like you going to the dentist every year or twice a year to have them examine you and to clean your teeth. We need to do that as well for your pets. And so an annual visit to your veterinarian is very important. And not only that, but we need to have daily home care. So the vet can do a good job of maintaining the teeth, but it's extremely important that you do daily home care, brushing the teeth, give them proper diet and proper chew things so that we can maintain the health of their teeth. Dental problems can cause or even be caused by other problems. So if we have broken teeth that are abscessed, that can affect the other organs in the body. I like to say, how goes the teeth, so goes the health. You take care of the mouth, you can help take care of the animal. So an oral exam involves looking at the pet and with the owner to show them what's going on. So you need to look at not only the teeth, but the tongue, the gums, the hard palate, the outside of the face, the eyes, the glands underneath the jaw, the salivary glands, to see what's infected. And if there are things that need to be done besides just cleaning the teeth. Broken teeth need to be addressed. Malalignment of teeth need to be addressed. So there's an awful lot that goes on beyond just looking in the mouth and just thinking that dogs and cats have good teeth. Further evaluation requires anesthesia to totally evaluate the mouth. Because you can imagine looking in your dog's mouth, he's not going to let you look very long. And so until you can get that dog under anesthesia where you can individually examine each tooth, clean the teeth, polish them, and then also take radiographs. Radiographs help you identify what's going on below the tooth line. See from the photo on the top, there's a lot of calculus and buildup on the teeth, but you really can't appreciate what's going on below the gum line. The x-ray or the radiograph that you see below that shows that there's bone loss around almost all of those teeth, which would necessitate extracting all of those teeth except the canine and that first little premolar. Other dental signs of health include bad breath, and you can imagine the smell of that dog's mouth when you raise the lip and look in there. You might do this on your own pets when you get home. Check their mouth, see what's underneath, and say, wow, you're going to be surprised how much problems that they have. Broken teeth. Pets chew on things that they shouldn't. We give them bones, we give them deer antlers, we give them rocks. All those things break teeth, and that leads to infection in the mouth. Young dogs and young cats should lose all their baby teeth and develop new teeth between 4 months and 7 months of age. If those baby teeth don't fall out, then they become doubled up and very crowded. Within that crowding, you can have bacteria, plaque, debris, hair that develops, and all that leads to periodontal disease. So it is extremely important that we take out those baby teeth when they're crowded. Teeth can become discolored from outside forces. Could be from tartar, it could be from water additives, it could be from medications that are given at an inappropriate age. All those things can cause the teeth to be discolored. This photo shows you the tartar that has built up over time and the infection that's going on in this dog's mouth. Abnormal chewing and drooling and dropping of food can be an indication of pain in the mouth. This is a cat's mouth. You see the first tooth behind the canine has got that red pulp showing on that tooth. That's proud flesh or covering of a cavity in that tooth where the pulp is exposed, and it's extremely painful, causing that cat to drop food and to drool and to be shy when you touch her face. Other signs are pain on bleeding or swelling in the mouth, and you can see the big swelling behind the canine tooth. That's a tumor that's formed in the dog's mouth, and that can be a very painful problem and a very severe problem that can cause the death of the patient. Other problems that occur are periodontal disease, and this is the #1 problem that dogs and cats have, is periodontal disease, and that's an infection of all the structures around the teeth. They include the gingiva and the bone and the periodontal ligament. And when you've got all that disease in there, the body, a natural host response is to try to get rid of the tooth to clear up the infection. And during that process, there's a lot of pain and discomfort that goes on with the patient. Broken teeth are extremely painful and harmful to the animal. When that tooth dies, it becomes infected. The infection gets in the bloodstream and causes disease in the heart and the kidney and the liver downstream. Abscessed or infected teeth can often be manifested by swelling below the eye or on the face, or a draining lesion on the chin, depending on which tooth is infected. In the picture on the left, you've got inflammation under the eye, and that's normally an indication where you've got an upper fourth premolar or a first molar that's infected that can be causing all that to show up. Other problems that we see in the mouth are cysts or tumors. This is an example of a tumor that's on the front part of the mouth between the canine and the corner incisor. Malocclusions can happen in any breed where we have an underbite or an overbite or just a few teeth that might be malaligned. This particular dog has an overbite, and you can see the lower canines are hitting in the roof of the mouth, punching a hole into the hard palate. A very uncomfortable problem that this dog is experiencing and that needs to be treated. This particular picture shows a fractured jaw behind the canines, where a dog was in a dog fight and the lower jaw was broken. There's all kind of fractures that you can get from dog fights, from hit by cars, or even jumping off of the couch in an older dog with a lot of periodontal disease can lead to a fractured jaw. Palate defects are usually congenital, or they're born with them. It can be in the front of the palate, it can be the whole length of the palate. It can be a cleft lip, like you see in some children that have cleft lips and cleft palates. These are problems that have to be corrected surgically. Periodontal disease, again, is the #1 problem that dogs have, and probably 95% of the disease I treat in dogs is periodontal disease. So early detection and treatment is critical. Prevention is the key with dentistry, and we need to prevent it. It's a much cheaper and much easier to do and much healthier for the pet if we will just prevent dental disease from occurring. There are 4 different stages of periodontal disease. And this disease, again, like I mentioned earlier, can be associated with kidney, liver, and heart muscle disease. The early periodontal disease is called gingivitis, and it's usually plaque that builds up on the teeth. It causes a slight odor, but you start getting redness of the gum and some inflammation of the gingival tissue. If you don't treat gingivitis, it's going to advance on to early periodontal disease. And that's when we start having the beginning of bone loss. You've got the smell starts to get worse. You have much more swelling of the attached gingiva. You start to see the pet maybe dropping a little bit of food. And if you don't treat early periodontal disease, it's going to progress on to advanced or moderate periodontal disease. In moderate periodontal disease, you've got up to half of the bone loss around the teeth. You've got a lot of pus that's beginning to come out of the teeth. The smell is beginning to be recognized. And if that's not treated, it will advance on to advanced periodontal disease where the teeth begin to fall out. The disease is very easily transmitted to the other organs, and it's a very severe problem, and it's a disease of neglect. We have neglected their mouth when it gets to this point. Home care, again, is equally important. Not only do we have to clean the teeth annually under anesthesia, but it's equally important that we have to maintain their health at home. Teeth need regular brushing. That's the gold standard, is to brush your pet's teeth. And it needs to be done every day or at least every other day in order to maintain good health. Patience and training is what's required. And you can train a dog, you can train a cat to have their teeth cleaned, and I'm going to show you a little training of a cat. This cat's cooperating quite a bit for having his teeth cleaned. And we can do the same thing with our dogs. It's just a matter of training them. Start out with a gauze on your finger, and with a cat you can use tuna water. With a dog you can use some of their favorite toothpaste. And it's important that you use a toothpaste that's designed for dogs and cats, because they can't spit out their toothpaste when they're through, so they swallow it. So it's important that you use a toothpaste that's designed for pets. Ask your vet about different types of dental products that are available. That may be diet, it may be toys, it may be chew toys. One of the things that you want to avoid is hard bones. You want to avoid deer antlers. Anything that can break the teeth, you need to avoid. At this time, I'd like to offer you a chance to ask me some questions about dental health.
Got some questions here. First of all, what happens when you take a dog's tooth out? Do they get a false tooth? What happens to them?
No, usually we don't put them false tooth in the mouth. Because dogs have 42 teeth to begin with. So when they miss one or two, it's not the end of the world. They can still function with teeth. There are many times that I have to take out all of the teeth of a dog or a cat from advanced periodontal disease, and you'll find that those dogs or cats can eat, and they can eat dry food without any teeth. But it's certainly more healthy for them to have their teeth. If they don't have any teeth, they're not going to be able in the wild to prehend their own food or to go out and get their food. But our pets, because we provide all the food that they need, they can eat dry food with no problem.
We have another. What happens to wild animals' teeth?
Wild animals' teeth get broken. There's no one to take care of them, so they often die early. Their life expectancy isn't as long because they die because of dental disease that has developed in their mouth from all their broken teeth. So they might live half the age of a normal dog.
And then we have one more that kind of goes along with that. How does disease from your teeth get into your body?
The bloodstream has little blood vessels that go into each and every tooth. And if you get the infection in that tooth, then that infection can get in the bloodstream that goes in and out of that tooth. There's also a lot of blood supplies around the teeth and the bone. So when you've got the infection that gets out of the tooth and into the bone, then that gets into the bloodstream and spreads to the rest of the body. And then it goes through the other tissues, the kidney, the liver. It's all filtered to get the bad stuff out. Well, then those bad bacteria end up lodging in the kidney or liver or the heart and causes secondary dental disease, or secondary disease caused by the onset of dental disease.
You mentioned that you need to take your pet to the veterinarian to see if there's any problem. Kind of what is the incidence of the average dog group that would have some disease? Is it 10% of the dogs, 50%?
A dog is 3 years of age or older, over 85% of them have some sort of periodontal disease. So it's a huge problem in our pets, and it's an area that had been neglected for many years. So we need to pay attention. It's a very important part of our disease. The number one disease in small animal medicine.
Okay, you mentioned well, you didn't mention that dogs can't talk to you. They can't tell you the problem, but they do in their behavior. So what is a couple of behaviors again that you don't like to see that would indicate some dental problem?
If you want to go up to your pet and grab him by, just rub his face, if the pet tends to shy away from you, he hurts, and as you start to touch him, he shies away. He drops food when he goes to the food bowl. He's hungry, he drops food, maybe he's off his diet. Cats may not groom themselves as well. They may drop their food. They may hide more instead of being around and play. So a good observer as a pet owner is very important, that you notice any abnormal changes in their behavior so you can point that out to the veterinarian when you go in to give him a key to look in the mouth.
I have a question. Do you ever fix teeth when they get broken?
Sure, you can fix teeth that are broken. One of the ways that you do that is to do what's called a root canal. If you can get to a tooth before it has advanced to the point where you've got a periodontal disease in conjunction with endodontic disease, then you can remove all the insides part of that tooth, the pulp and the nerve, and refill it with a cement to seal it off. You keep the tooth, its function, the tooth is no longer alive or has proprioception, but it is still functional. And so we do that often on canine teeth and some of the primary teeth, the carnassial teeth. And whether or not you put a crown on it depends on the age of the dog and the use of that tooth. Police dogs, I usually put metal crowns on them after I do a root canal.
Do large animals like horses and cattle have dental health care?
They have dental health care, and they have a lot of dental health needs, especially horses. With their grinding motion that I showed you on that little video, they get a lot of wear on those teeth that is abnormal, and you get sharp points on those teeth. And those sharp points, if they're not filed down or floated, as we refer to that, then they become where they can't chew their food properly. They start dropping their food. Or if a horse has a bad behavior of cribbing or chewing on the fences around his paddock, then that can wear the teeth and cause disease. If you get a buildup of hay in between teeth, you can get advanced periodontal disease. So it's very important that horses and cows have their teeth monitored by your veterinarian and treated appropriately.
Does that happen under anesthesia as well?
Horses usually happens under tranquilization. They don't undergo full anesthesia, but they are tranquilized so that they can be handled.
So in some animals, the tooth continues to erupt. That's different in like a cat versus a horse?
Yeah, horses, their teeth continue to erupt. So as they grind down, they continually wear on each other. And if you have abnormal occlusion, then those teeth erupt and don't have anything to wear down on it. Rabbits have incisors that continually erupt, and their premolars and molars have continued to erupt. And so if you don't float those teeth to keep them into normal occlusion, it causes periodontal disease. And with the rabbit incisors, if those teeth don't align properly, then they are a malocclusion, then they can't even prehend their food. So it is a very important problem.
You mentioned the difference between a horse which had teeth on the top and bottom in the front and a cow. Does that mean a horse can eat shorter grass than a cow can, or is it about the same?
Oh, I don't know, since I don't treat cows very often, but I would assume it's very similar.
Do people bring in things like rabbits or guinea pigs, hamsters, pocket pets to have their teeth cared for?
Yes, they do, and our zoo veterinarians normally take care of all of those, but I do the dental work on rabbits, prairie dogs, guinea pigs, aardvarks, lions, tigers, all of those animals, the exotic animals, all have teeth, all have problems, and unfortunately, too often they're neglected and they die at an early age.
Could you say a little bit about your background, what you do, what your daily life is like, and also maybe your contribution to continue education of other veterinarians as you go along?
Well, for 26 years I worked in private practice where I treated the whole body of an animal, and I developed an interest in dentistry. So my daily life now revolves around taking care of the oral cavity of dogs and cats, and with exotics thrown in there on an occasion. Now that includes not only cleaning their teeth, but taking care of malocclusions, extracting teeth. I've done orthodontics to realign teeth so that they fit properly, to make an animal's health much better. As far as education, I do a lot of conventions, veterinary conventions, where I teach veterinary dentistry in both lecture and lab settings. And I've been doing that for 25 years, going all over the United States, because unfortunately veterinary dentistry is not taught very often in very many vet schools. In veterinary schools, there are only about 7 or 8 schools that have a veterinary dentist on staff. So we're trying to change that and trying to emphasize the importance of oral health in the pet.
So how did you become interested in dentistry if you were working with the whole body?
Well, it's interesting. Undergraduate, when I was still an undergraduate student, my interest was in human dentistry, and I wanted to go to dental school. My senior year, I made the alternate list for the dental school that I applied to, and at the same time, I was drafted by the military. So I didn't get a chance to go to dental school, and in the military, I was a medic. So I spent 4 years in the Air Force as a medic, and I went to the vet hospital. I went to the dental office. I went to the ophthalmology office. I worked in the hospital. So I saw, well, veterinary medicine, that encompassed all of that. So I decided to try and apply for veterinary school after I got out of the military. I didn't know they didn't teach dentistry, so for 7 years in private practice, I made every mistake that could be made in dentistry because I didn't know what I was doing. I had a chance to go to a dental seminar after 7 years into practice, and soon quickly realized why I was making all the mistakes and why the pets were not getting any better when I cleaned their teeth. And so it motivated me to start taking every CE course that I could take that dealt with dentistry. And that passion, because my colleagues had not been trained, I started sharing all that information with my surrounding veterinary clinics by going in on weekends with them and helping them with their pets and their patients, showing them how to properly clean teeth. And from there, it just kind of expanded, where I ended up going all over the United States teaching veterinarians how to do the things that we should be doing on an everyday basis.
Whenever you have a rotation of the 4th year students, how many do you have, and kind of what are the different steps you take along the way, like where you teach them first and where you teach them the last day?
Well, the 4th year students, I have a rotation of 3 to 4 students, and they learn to clean the teeth, they learn to take x-rays, and they should have already learned how to extract teeth in the 3rd year rotation. So the 3rd year rotation is where I teach them the basics of how to do the things that they need to do. So if you haven't taken the elective in the 4th year, you're kind of behind the 8 ball, and you don't know as much as those that did the elective. But I try to let them do as much as they possibly can so that they have a good understanding of what is needed in private practice. And so they learn how to also sharpen and take care of the instruments as well.
When you said that when you were in practice you weren't cleaning teeth properly, what did you change in a nutshell when you went to the seminar and learned the proper way to clean teeth?
What do I do different now than what I did before? The use of the ultrasonic scaler was the biggest mistake we made. I'm going to show you on my hand here that the tip of that ultrasonic scaler is going against a tooth in a fashion like this. Most people use an ultrasonic scaler with a tip, pointing the tip at the tooth, and then as they clean the tooth, they're actually jackhammering that tooth, causing all kind of etches in that. And then polish, they don't polish the teeth, that's just something you do for humans for cosmetics. Well, that final step of polishing is actually smoothing out all those edges that we created in the teeth. So learning how to properly use an ultrasonic scaler was the big difference. Learning how to, after you use an ultrasonic scaler, then to use hand scaling, so you can finally start removing some of those edges that you created by improperly using an ultrasonic. So using an ultrasonic properly, using hand instruments, polishing, taking radiographs, all these things are incorporated, make you learn how to handle the teeth a lot better.
We have one final question. I think we're about to time for that. They want to know, do dogs or cats have braces?
Yes, they do, and I've put braces on a number of dogs, but it's not for show quality, but it's for function of the mouth. So if teeth don't align properly, dogs have a hard time chewing properly, just like people do. So you put braces on their teeth to allow them to have the proper occlusion so they can properly apprehend their food so that they can eat.
So you mentioned that we might want to look at your pet's teeth, but those teeth are associated with them biting you too. So what kind of precautions should someone take whenever they're starting brushing the teeth of their dog?
Well, you can start by putting your hand, and I'm going to use this model, putting your hand over the muzzle, keeping the mouth closed. And then just inserting your finger, raise the lips, and inserting your finger with the gauze and just rub on the teeth. And that, by keeping the mouth closed, they're not going to bite you. And you can get all of these teeth except the lower molars just in this fashion. So it's very easy to do. And reward them. When you get through, reward them with a treat. You know, talk to them softly, spoil them. But that's the easy way to do that.
Think so?
Thank you.